Hi, everyone. Happy Monday. Today, I have the pleasure to be here with Dr. Jeff Gross. He's a neurosurgeon based out of Nevada and also California. How are you doing today?
Great. Thanks for having me. It's good to talk to you and everyone listening.
Yeah, awesome. Well, today we are actually going to have a great conversation. I want to make people think today, okay? And thought provoking and just very good, some questions that I see, on LinkedIn, and I want to address them. And, it causes a lot of confusion, right? And I want us to, regenerative medicine and stem cells is a very hot topic today and for good reason, right? And so we're going to be going over many questions today. And first question for you: who are you? For the people that don't know you, right? Who are you, and what is your mission?
Well, as you said, I'm Dr. Jeff Gross. You can call me Jeff. I am a recovering neurological surgeon, spine surgeon. I practiced for decades. I became somewhat frustrated with the status quo, with the lack of advancement in what we're doing as spinal surgeons and neurosurgeons. Um, yes, there are new widgets or smaller incisions and things, but what we're actually doing for the spine hadn't changed. We're either making more room or fusing it together. So, being a molecular biologist, biochemist from college, and an ongoing science bio nerd, I really saw we were missing something, and my patients get really the full credit. They were asking me, "What about stem cells?" for years, and I said, "Well, I don't know. I haven't learned. We don't learn about that at the annual meeting. We don't learn about that when we, study to retake our board certifications and things." So finally, I just took it upon myself one year and did not go to the annual bow tie wearing, goofball neurosurgery meeting where they're all talking about the same thing they've done for decades and decades. And I went to a stem cell conference about 7 years ago, and it opened my eyes to all that's changed since I was an undergraduate studying that field and all the good medical evidence that exists in Europe and in Asia and some here in the States as well. And I decided I need to add this as a tool to my toolbox of treatments because it's less invasive, natural, has a very low side effect profile, and it can be helpful to delay or even prevent the need for surgery. And it has blossomed my practice now into treating more than just nervous system and the spine. I treat joints, we treat other parts of the body, systemic and well beyond. And then now I'm a full-time regenerative, you know, um, cutting edge, logically thinking doctor moving forward and helping make options available for people who need the right to try. So that's my mission.
Awesome. Yeah, that you hit, some great points there. I have been talking to many physicians, and a lot of them say the same thing. Um, we have a thinking problem, not a product problem, right? And it's something that hit me, and I see the more and more I speak to physicians, I hear that more often, right? And who do you help? What are the main conditions that you're focusing on more, or that you see a lot in your practice?
Well, I'm gonna use this platform to educate as well.
Of
So
course.
you use the word conditions, and just this discussion is for educational purposes. We're not
Yes.
making any claims that we are treating or curing a disease or condition.
Correct.
So
Okay.
not my words, but I want to maintain compliance as we always do with with certain things. I'm sure we'll circle back to that. But we see most often musculoskeletal problems, joint issues, loss of cartilage, wear and tear. This is a process also known as osteoarthritis, or some doctors dumb it down to the word arthritis because they don't want to explain it or they don't understand it. And then the end stage of that is called bone on bone. If you look at the progression of cartilage loss, eventually two bones are kissing each other.
Yeah.
So that's the most common thing we address: patients with spine and joint problems who are trying to avoid surgery. So my mission is to help them try and avoid surgery.
Yes.
um, The second group would be systemic inflammatory problems, which is a very big bucket of things, from autoimmune inflammation, which is hyperinflamed states, certain infections which cause too much inflammation, like long COVID, Lyme's disease, and others. And then most diseases of aging are diseases of inflammation. Even Alzheimer's has an inflammatory component. MS. We have some inflammatory changes in Parkinson's. In atherosclerosis, hardening of the arteries has an inflammatory component. Um, all of these things we address. We also see people recovering from stroke and heart attack and brain injury. We see athletes recovering from injuries. And we have so many tools that we're around, but unless you can't put down that sick care system Kool-Aid, you're
Yeah.
really not hearing about. You have to go seek it. So peptides, regenerative biologics like stem cells, secretome, which means what they secrete, like exosomes and growth factors, and all kinds of things out there, from PRP all the way up through specialty exosomes.
Awesome. Yeah. First of all, I actually want to thank you for correcting me when treating, because we need more of that, right? And I feel like a lot of people are scared to have these types of conversations because of non-compliancy, right? Like to me, I want to have these conversations because it educates people, right? I want to be open, right? I'm not perfect. No one is perfect, right? And so having these conversations, understanding the legality, what we can say, and protecting ourselves at the end of the day, that's what's very important, right? So I really appreciate you for correcting me and saying, and saying that disclaimer, which is huge.
Thank you. Yeah.
Okay. On your LinkedIn, you call yourself Stem Cell Whisperer. How did that name came about?
Yeah, a patient did that and posted something on social media, and it kind of stuck, and it was cute, so we kept it. But because a lot of what we do now has
Mm.
is not directly using stem cells, but
Yep.
we can help stimulate our own stem cell and cell activity in a more youthful way. Because it's a funny thing, when you look at regenerative medicine as a whole, our bodies know how to heal. They have the blueprint, they have the genetic code. It's just about reopening those genes to be called upon, the proteins to be made in the cell. And you think about a child, like a 3-year-old scrapes his knee on the sidewalk, and mom cleans it up, puts some Bactina on it, puts a Band-Aid on it, kisses him, sends him on his way, right? And then 3 days later in the bathtub, the Band-Aid comes off and the scab is almost completely healed.
Yep.
But, Oscar, you or even someone older like me, I banged my arm at the gym or something, and man, I got a bruise for 2 weeks. Like, wait, I'm the same 3-year-old from years ago that used to heal in 3 days. What happened?
Yep.
So, our cells need a reminding, and that's really what the biologics are doing. They're whispering to our stem cells to, hey, behave like a 3-year-old and heal real quick.
Which are the signals that I keep on listening, right?
Yes, exactly. This is signaling medicine. We should
Yeah.
probably, in fact, you use the phrase or the abbreviation MSCs, which people used to think stands for mesenchymal stem cells. Well, some have advocated that it's medicinal signaling cells.
Yep.
Yeah, because you're absolutely right. This is about signaling. It's encouraging our body to behave in a certain way. Supplements do that. Epigenetic lifestyle changes do that too. Like if you do a 72-hour fast, or you use the hot sauna, or you exercise really hard, you're sending signals, internal signals. Well, the strategy is to also use some external signals to get to really juice it up and get it going. With it's sort of it's a hack, and that's kind of where the term biohacking fits
Yeah.
in.
Yeah. I had a conversation with a scientist a couple weeks ago, and I believe Arnold Kaplan was the one that that said about the signaling,
Yeah, I
something
think
like
that's
that.
right.
Yeah. Yeah. So yeah, I've been learning a lot by having conversations with physicians and scientists. So I'm catching up. I'm catching up. Okay.
And we learn from the questions you ask and the questions that patients ask. What do they
Interesting.
want to learn? What do they need to know? And sometimes we as clinicians have to go back and re-educate, right? Because what we learned in our residency and medical school was so highly influenced
Hmm.
by entities like big pharma, and was taught to us by people who are, you know, trained 30 to 50 years earlier. So what I learned as a spine surgeon wasn't very different than 2 generations earlier.
Hmm. That's kind of sad because
It is.
medicine changes fast. you
Well,
know?
it should, and
Yeah.
hopefully we're tweaking it now where these conversations can lead to that. But residency training is very similar in terms of what they learn to do. At least spine surgery and neurosurgery. It's the same set of operations, the same emergencies. Yes, there's a little more knowledge here and there, but when I go to the annual meetings, which I stopped going to,
Yep.
they literally had someone reporting on a 10-year history of some procedure. That same paper was reported 30 years ago. They just did it over again. So it's
Yep.
recycling the same stuff.
Yeah. Well, it seems that we have to create a new conference, right?
Absolutely.
Yeah. Okay. So, um, I've been super active on LinkedIn, right? And I'm a very curious person, right? To where I ask a lot of questions. And on one side, you have patients like what you mentioned, experiencing life-changing outcomes, walking again, avoiding surgery, reversing certain diseases. The list goes on, right?
Hmm.
To which I've actually heard, I've been meeting a lot of people that have been getting into the stem cell industry or
Yeah.
regenerative medicine, because they used a doctor used exosomes or stem cells
Hmm.
and help their parents or their grandparents with with a certain disease, right? And we have doctors like yourself openly talking about it, right? But on the other side, we have critics, right? That they're saying that they're unapproved therapies, that perinatal stem cells are a scam, they have no live cells, and then there's legal gray zones, right? And there's often there's also
Yeah.
safety concerns, which I think that
Yeah.
anything really has safety concerns.
Hmm.
And in my opinion, I think that there are valid reasons, valid concerns, right? Then, in addition to that, you have the FDA that has been clear about regenerative products that they're not approved, etc. Then you have misinformation. Then you have stem cell manufacturers not playing by the book, right? You have bad players. They're not FDA compliant. Some are
Yep.
even receiving warning letters. So with someone that, if someone is from the outside, right, that is looking at all of this, okay, why do you, why is it, what is your message to them,
Yeah.
right? Because it's so
Yeah.
confusing, right, with everything going on.
Well, I would love to break down each one of those elements you listed
Okay.
and handle it and clear the waves on that, because there are haters out there. But look at those haters. What are they selling? Where did they open their mind to updated information and education, or are they stuck in a traditional Kool-Aid, consume, sick care kind of nonsense? And yeah, there are bad actors, and there are ways to do this properly, compliant, safe. So um, let's deal with those one at a time. Is that okay? You go back
Of
through that
course.
list.
Yes,
Yeah.
of course, of
Okay.
course. So, for example,
Hmm.
perinatal stem cells are a scam, right?
Okay.
And they have no live cells.
Okay. Well, I mean, that depends on the source and the
True.
testing that's done to verify. If you, by the way, we talk about regenerative biologics. Like I said, it could be cells,
Yep.
it could be what the cells secrete, which
Yep.
could be vesicles called exosomes. It could be growth factors. It could be both. And you can go all the way from the lowest level, the bottom rung is PRP, platelet rich plasma, all the
Yep.
way up through specialty exosomes. And PRP is way down here, and stem cell and their what they secrete, the exosomes are up here. And that it depends on the clinician, what they have access to, what sources, and this all has to be vetted. So when I look at a supplier, because I don't supply biologics, I buy them and then clinically offer them to people, you know, compliantly. So when you get to a lab that produces them, is it an FDA certified lab? Okay, that means that they follow certain clean processes, documentation processes, a host of things to be
Correct.
certified. And commonly, when you see a warning letter go out from the FDA to one of these places because they didn't document something properly, or they didn't, they go through these very stringent audits where people, like IRS agent type people from the FDA come and, to keep their job, they have to find little little things wrong, right? So
Right.
they make it like that. But there's a very stringent process by which labs make available these clean and they're making available what they say they're making available. If it's cells, how many cells are they viable? So it depends on the source, and
Right.
are there scams out there? Absolutely, there are scams out there. And how do you detect the scams? Are they promising you the world? We can cure a disease? Probably not for you. Number two, if it's a very low number of cells or low number of exosomes, and we can talk about what's
Yep.
low and what's high, um, then that's probably a scam of sorts. If it just depends, and that's why it's really important to do your homework and get multiple opinions.
Yep.
And if someone's overselling their way or the highway, then it's probably not proper. You want someone reasonable who knows how to say, "Hey, I can't make a claim that we're curing or treating a disease or condition, and but I can show you some medical evidence, some journal articles." Because remember, a lot of this has been done in Europe and Asia for decades. There's great scientific evidence and publications. We can share that. We can share before and afters. Oscar, I can show you MRIs of knees we've done before and after where the cartilage has thickened. Now, most orthopedic surgeons will not know that you can regrow your own cartilage. And
Yeah.
I didn't know that until I researched it and tried it. So it's possible. I'm not guaranteeing it. It's possible
Yes. Why do you think stem cells are controversial here in the United States? If
because they're
other
cutting
countries
into
have
big
been,
pharma. They're going to cut into
yeah,
big money that goes into pharmaceuticals and implants. There are so many thousands of knee replacements every year. If you cut into that multi-billion-dollar industry, you're making someone very cranky.
yeah, I agree with that. Okay, so in your personal experience, what is your personal red line from the moment when you say this is no longer ethical or defensible to offer?
Well, I think we can't make a claim or guarantee
Right.
anything, and I have patients that I'm transparent with everyone about that. We have documentation for it, and the patient will say, "But this will fix me, right?" I say, "No." I have to sit them back down and go, "No, we don't know that. Here are some examples. Here's why I'm offering it to you because I think we could possibly help you."
Yeah.
I've helped family members and friends and many patients, and I've switched my entire machinery from neurosurgery, doing spine fusions and other surgeries down to doing, these injections because it's a lot less risky to do an injection, a lot fewer side effects. And the benefits are potential without downtime, without the risks of surgery, without the cost of surgery, et cetera. So we really break it down and make sure people understand. So the red line there is with the claim. With the source, I want to make sure we have the best source. So I go to labs, I vet the source. It's something I would not use something on a patient I would not use on myself. And I have used biologics on myself. And I continue to use biologics on myself. And I love them. That's my personal, that's not me, the doctor. That's just me, the person saying
Yep.
it. So there's a red line there. I don't like to use, international materials unless there's a specialty item I can't get nationally, because I want to be able to use FDA certified labs.
Yes.
So, because I know that process is a very difficult process to go through.
Yep.
So those are some of the red lines for me, I think. And we don't use them just to try them. We use them at people I really think we can move the needle on. So they have to be patients that are willing to, have an anti-inflammatory lifestyle, be healthy, because the biologics will work better in that environment. So we look at the whole patient. We don't just throw biologics at them.
Yeah, that's awesome. That is awesome because patients are supposed to do, their part as well, right? If they do not have a healthy lifestyle, then might not work, right? And that's with pretty
Right.
much anything in life. Um, okay, so do you have patients that ask you like, "Oh, I want to maybe not you because you're known to help them in stem cells and regenerative medicine, but hey, I'm looking to go to outside of the country to Mexico or Costa Rica to get
Yeah.
stem cell injections. Like, what do you
Yeah.
say to those patients that come to you and ask that?
I tell them do their homework. It's a great place for vacation. And if they want to package that with a regenerative procedure, great. We can do the same thing here through an FDA certified lab, through a non COVID vaccinated donor, potentially. Most of the materials we get are from non COVID vaccinated donors. Um, and it's usually less costly, especially when we get into the exosome and growth factor and secretome area. It's less expensive than the Costa Rica trip. But there's something wrong with that. I don't know exactly what you're getting there.
Yeah,
It doesn't mean it's bad or it's good. I'm not saying either way. I don't know. I haven't vetted those sources. I don't know what the regulatory landscape is in other countries. So just do your homework. That's all.
yeah. No, yeah, we often hear that a lot. Obviously, you have to go outside, right? I when I talk to my friends, they ask me like, "Oh," I'm like, "Why?" I'm like, "You can do it here in the United States, right?" And so, yeah, I'm not sure where that even information came from. That you have to go outside of the
Yeah,
U.S.
there are a lot of myths that get perpetuated. This people still think that, stem cells and related biologics are illegal. And in the US, they're not. They're not at all. We've been doing them for decades in spine surgery, been using, stem cells from bone marrow and bone graft and then we have BMP, which is bone morphogenic protein. That's a biologic,
Never heard
you
of
know.
that one.
It's commonly used in spine and orthopedic surgeries and dental or uh, oral surgeries to grow bone. It's a growth factor, and
Yeah,
that is a biologic that's made. And
yeah.
so wow, there are all these great biologics that are only selectively used when some big pharma company is allowed to, bring it to market. So,
Yeah.
so you have to understand, and people don't, that it's not illegal. The FDA approved. Let's talk about what that means, because I think there's a myth out there, and a lot of the haters on internet, some of the real, guys who say stuff who probably shouldn't, are don't understand. They think this stuff is not FDA approved. Let's talk about approved.
Okay.
FDA approved means for marketing claims. FDA does not regulate the practice of medicine. It does not tell clinicians what to do or patients what to receive. FDA was set up by Congress to protect consumers with marketing claims so we don't have snake oil out there, right? Oh, this will cure diabetes. It's not like that. So when a company wants to bring a product to market and make claims about the product, like this product does this thing, then they have to go through that process. And there are different pathways on that process through the FDA. There's in the biologics, there's 351, 361. We don't need to get too technical here. Those are for bringing something to market where you can make a claim. Otherwise, don't make a claim. As long as it's FDA certified, clean, and autologous, meaning you're using it in the body for the same type of thing that it was biologically, meant
Hmm.
for, it's okay. We just can't make claims. So it's very important. And those claims are curing, treating disease condition, right? And this applies to biologics, it applies to drugs, it applies to devices.
Peptides, vitamins.
Yeah, the supplement side's a little easier because you simply put on the bottle, the FDA has not evaluated. So let's talk
Mhm.
about that.
Interesting.
So if something's not yet FDA approved, that doesn't mean it's unapproved or disapproved.
Okay.
For the LinkedIn haters out there, it means it's not yet evaluated. They don't know yet. So
Yes.
if you have a website, let's say you're a stem cell clinic in some city in the US, you make a claim, hey, we cure diabetes. You'll get a warning letter
Yep.
because you made a marketing claim that's not yet officiated by some selected panel of
Yeah.
experts who look at the literature. You may be able to say, look, I've got 17 journal articles from Europe where they've cured diabetes with this stem cell, this type of approach, this protocol. You may be right. You may have the evidence to support that, but you can't make the claim because that's what the FDA regulates here. So little carve out of free speech there, and under the heading of protecting consumers, you just can't make
Yes.
that claim. You can say we help your body; these stem cells can help your body heal at a younger rate. We help your body fight inflammatory diseases like diabetes. You just can't say you're curing or treating that disease or
Yeah.
condition.
Another question that I hear a lot is that, what I see often is, hey, but the FDA, made a public statement saying that it's illegal, right? Like, so, someone that it's from the outside, again, they're seeing all of this. What do you say to that? What is your rebuttal to that?
Show me that document. It's not illegal. In fact,
Yeah.
this isn't criminal.
Yeah.
If you are non-compliant, you get a warning letter. You're simply non-compliant.
Yeah.
It's a civil issue.
Yeah.
Sure, if someone's doing crazy stuff,
Like
they
with anything
they
in
can
life.
get a criminal referral. But
Yeah.
these aren't crimes. It's not illegal. It's
Yeah.
maybe non-compliant with it's like an FTC violation or
Hmm.
SEC violation. They're not all criminal.
Yeah.
You get a warning letter or you get a fine or something. If Just don't make the claim. You're not supposed to make the claim. Follow the rules. It's very easy to follow the rules, people.
Yes, and I agree with that. But a lot of people, they just follow what everyone is saying and they don't do their due diligence, and hey, that's totally okay.
Yeah,
At least for
sad for them, for people who can't think independently and do their own homework, or who drink the Kool-Aid, or worse, spew the Kool-Aid on LinkedIn like it's the only Kool-Aid there is. Very
yeah,
rude and
yeah,
very inappropriate.
yeah, I agree.
Very unprofessional.
Very unprofessional, and and this is why I took it up on myself to reach out to you and other doctors and have these conversations, because at the end of the day, yeah, you're very welcome. Because at the end of the day, it's the patients, it's my mom, your our parents, right?
Yeah,
Everyone that is looking for hope, right?
right.
And so I strongly feel that, for the critics and the people that are saying, that are fear mongering, and that are saying that this, and not allowing other doctors to use these therapies, it's a total, they're not allowing patients to heal, right? To see these options, to get better. And it's sad at the end of the day.
It's a good point. Their misinformation and disinformation is actually potentially hurting patients. So, in a way, they are violating their Hippocratic oath.
They're what? I'm sorry?
In a way, they
Mhm.
are violating their Hippocratic oath to help patients.
Okay. And how can you elaborate a little bit of that? Because I'm not too familiar with that.
Sure. So, if I were spewing nonsense on LinkedIn and potential patients are seeing that, this misinformation and disinformation, oh, stem cells are illegal, whatever. Um, some patient may decide not to pursue it.
I'm sure there's
Potential
been
patient,
a
and
lot.
and that treatment could be the difference maker for that patient in the long run. So therefore, these people with the misinformation on LinkedIn are doing a disservice to those patients. They are therefore violating their Hippocratic oath, because the Hippocratic oath states we're here to help relieve pain and suffering. So so that disinformation is actually indirectly increasing pain and suffering.
I agree with you on that. I've heard the Hippocratic Oath, but that makes total sense. Thanks for explaining that. And okay, so another very common question that I see a lot is, that doctors can lose their license if they use unapproved therapies. What do what is your response to that?
So the word approved here is vague and ambiguous.
Okay.
Remember, FDA approved means marketing claims.
Yeah.
So I suppose a state medical board could take up an issue with someone who's making claims they shouldn't be making repeatedly, and discipline that person, because there are a lot of people on medical boards who don't have the open mind, right? These are doctors that usually are more on the administrative side of thing that join these boards. So that could happen as probably an unjust
Yep.
ramification.
Yep. Of course. Like, I mean, if you're doing something that you're not supposed to, right? Obviously, like, it can happen. But for using these therapies, I mean, I not, because the reason why I ask is because I've seen it a lot, but then I see so many physicians using these treatments, openly talking about it. So it's like, what's going on, right? So that's why it just confuses me.
Well, let's take care of that confusion, because if it confuses you, it confuses many others. And I know that because patients come to me, ask the questions as well. And I do a lot of educating on podcasts and things. So again, FDA approved means for marketing claims. FDA does not approve what doctors can do. That's for state medical boards and national boards, right? To look at. In fact, even the boards don't know what they can do, and the boards are, Kool-Aid consumers as well. So you have to be very careful. So again, don't make any claims if you're a clinician. Patients don't expect claims. But I'm a surgeon. I never guaranteed the result of a surgery. You can never do that anyway. So we're used to not making claims and talking about risks and benefits through a very important doctrine, a process called informed consent. And that informed consent means here are all the options. We have a duty to say, here are all the options. Let's go over them together, risks and benefits, pros and cons. To help a patient make an educated decision, we have to educate the patient. If you are not using regenerative biologics as a potential
Hmm.
option, you are not fulfilling your duty under informed consent. If you're a surgeon saying, ma'am, I need to do a knee replacement, here are all the other options: more cortisone injections, hyaluronic acid injections, and regenerative medicine, and you skip that regenerative medicine step, you are violating informed consent doctrine.
Hmm. Interesting. Interesting. So, in from your experience, what are the biggest legal liabilities that a clinician may face, right, when using these products?
I don't think the liability is any different from any other treatment we might offer. We want to
Hmm.
follow, the best practices.
Yeah.
So everything should be vetted. It should be, handled in the proper handling. For example, in our office, we have two freezers for biologics. I have a -30°C and a -80°C, where we keep different biologics. We have sterile handling procedures. Equipment, sterile gloves, personal protection equipment. We do everything as if, it's a surgery.
Yeah.
So it's handling, it's treatment, and again, informed consent. Got to go over all the options. So when patients come in, I say, I have regenerative biologics, but surgery is one way that this is addressed. Cortisone injections is one way. I say, I don't do some of those things, but we can refer you out if you want to have those things. And I do recommend people get second and third opinions.
Yeah.
Ask around, do your homework.
Interesting. Yeah. Yeah, I mean, informed consent is huge, right? And that goes with every treatment that, you're supposed to sign saying that you agree and you understand what's going to be done. And it's just giving permission at the end of the day and making sure that you're taking care of that.
Oscar, that's interesting. It's not just the signed form. The process of informed consent is a dialogue. It's a discussion.
Hmm.
The signed form is just sort of a confirmation that that discussion was held.
And that makes sense for documentation.
Right.
Hmm. Okay. And is there a certain process? Obviously, does it have to be thorough? I mean, obviously, I'm sure that has to also go through legal. An attorney has to make sure that you're right. Is that correct?
I mean, yeah, you can. I mean, it's hard to find attorneys who actually understand what the FDA does and how
Oh,
it's regulated. But you don't have to have an attorney as long as you have a really good informed consent process and you're doing everything right and you vet the source, and the source is FDA certified,
yeah.
in the US, and they
True.
go through, American Tissue Bank services for donated materials and things like that. So everything's handled at the highest level, and that you sought to handle it at the highest level and seek sources at the highest level. And you follow those protocols and you create protocols around there. Yeah. And the informed consent process, you can have your attorney look at it. Sometimes we're educating the attorneys, because they're attorneys. I treat a lot of
True.
attorneys. Happen to have uh, be close to a lot of attorneys, and many of them have the same questions. I thought that was illegal, you know. So,
Interesting.
so a lot of attorneys, they have to be specialists on what the FDA does. They regulate marketing claims.
Interesting. Very interesting. That's good information. Okay. Another very common question that I see a lot is that that stem cells, the use of stem cells is not malpractice insurance usually doesn't cover it, and they're afraid of that. How do you um, navigate that?
Yeah, I mean, I've been able to get liability insurance to cover regenerative medicine.
Okay.
It's a growing field. You may have to, change companies to find it. There are ways to do it.
Okay. Okay. That's a very common question that I see. So then I know we discussed a little bit um on informed consent, and one question is that can patients still sue a physician if an adverse event happens, right? And what do courts usually care about most if we even haven't gotten that far, right?
Yeah. It's America. You can sue anyone for anything. That's not unknown.
It's
You
true.
can sue for an adverse outcome. It's very difficult to prove that in a medical setting,
Yeah.
particularly if the informed consent was tight, meaning they went over all the risks and benefits. They did not make any claims. That's the key
Yeah, it's
part of it.
making claims. That
Yeah.
is huge. I mean, about because I've every time I see someone get a warning letter, the first thing I do is I review it. I want to know what's going on, right? Like anyone in the industry. And most of them is because they're making claims on their on the website, either via brochures, their website, or wherever they're claiming. It's not because something bad happened, right? And then if it's on the manufacturer side, maybe they weren't practicing good manufacturing standards, right? Is it clean? Things that they're supposed to be following, right? So that's what I see mostly, though.
Right, and let's point that out. The FDA
Yeah,
sends warning letters to clinicians who are mismarketing, they're making claims, or labs or companies that produce or supply biologics because they may be making a claim or something in their lab audit for their lab certification may be
yeah.
off, which, by the way, all the labs have something off. There's no lab that's had 100% grade.
It's a like what you mentioned earlier, right? It's a new field. It's a new industry. So we're all figuring it out as we go.
It's ashamedly newish to the US. It's
Okay.
not new in the world.
Interesting. Interesting.
Yeah.
That's you this is like the second time you correct me on that. You are absolutely
Well,
right
I
about
mean,
that.
look at we've had, professional athletes for over 20 years leaving the country to go get stem cells, right? You got
Yep.
Peyton Manning and Tiger Woods and
Yep.
Aaron Rodgers doing peptides and all kinds of stuff to heal his ankle. I mean, come on. Um,
Very true.
it, look and it, quietly, a lot of professional athletes are doing that. I'm not allowed to name anyone, but
Yep.
we have good sports here in Las Vegas. I'll say that.
Yeah. I mean, patients are even openly, talking about it. I think I saw one of the Kardashians recently got, I think, a secretome injection or something like that in with a doctor over in California. Right. That was the first time I ever heard of that. And, she's now, when they talk about it, everyone now knows about it. Right. I remember they were the first ones to kind of, um, something about the vampire facial or the vampire facelift whenever PRP was a big thing and they, the bloody face came out. I think that was the first time I ever heard of that.
It's been around. I don't know. Yeah, they popularize a lot of things because they have such attention. But yeah,
Yeah.
I know they've been getting Muse cells. They've been getting other things, and it's not just them. We have other people of note who are sometimes quietly and sometimes openly sharing their journey with regenerative medicine, whether it's low level PRP or higher level cells or secretome or specialty cells or specialty vesicles, exosomes.
Yeah.
There, regenerative biologics is a growing basket of options.
Yeah. And you mentioned just now, a lower level PRP and then a higher level secretomes and other biologics. Is that because PRP is autologous and it doesn't have stem cells, right? It has platelets, growth factors that help us with, you know, uh,
Hmm.
with certain regeneration part of our body, right? With the
Yeah.
healing process, I would say. So, but because it doesn't have any stem cells or it has a certain capacity to, is that why you call it low level?
No, it's low level because of the strength of what you can pull from someone's own body, own plasma. I mean, you can't take all their plasma, right? They're using it, so it's a limited amount of plasma, of platelet-rich plasma. It's often from an adult, and the adult, you know, has accumulated decades of inflammation. So
Yep.
the secretome is the growth factors may not be the right profile, the best profile that you would get from, let's say, a perfect neonate, or or perinatal, you know,
Yep.
tissues. So it's very low level because often you have to go for multiple sessions.
Yep.
Uh, Whereas with regenerative biologics, sometimes one session is all you need. Um,
Mm.
I mean, other higher level regenerative biologics. So
Yep.
I call it lower level because it's just in general, it's a lower strength
Yeah.
and lower effect overall. That doesn't mean it's wrong. It can be very helpful.
Correct.
I don't do PRP in my practice because we jump to the higher off the shelf things. I'd
Yep.
much rather have, when I take my car, Oscar, to get the oil change, I want some new fresh oil put in the car. I don't want I want the old oil put back in. So I don't want
Recycle
my
and
own
do
stem
anything.
cells or my own plasma. I want the young stuff. So we get the donated here in America through American Tissue Bank Services, vetted labs, FDA certified labs, tested, screened, certificate of analysis with each sample. That's what we're using. And if it were illegal, how come there are, scores of these companies supplying tissue? Of
Yeah.
course it's not illegal. That's what some people want you to say. And the people
Correct.
spewing the disinformation have a vested interest in people believing disinformed information.
I agree. I agree with everything that you said. Um, let's say if, knock on wood, right? If someone receives an FDA warning letter, what would be the first? What would you recommend that they do? The first thing. What do you recommend?
Read the letter and correct the non-compliance. So if your website's said something it shouldn't say, and change your website.
Yep. And then obviously, you mentioned that attorneys, some of them are new, right? So it's kind of difficult or challenging to find a good attorney that understands these new laws, right? So how would you recommend, what would you recommend for someone to search an attorney? Like, what would you, if yeah, like, to protect them legally, right? How can they help
Attorney can't
themselves?
always protect you legally. You have to find the right one. There are
Yeah.
some attorneys who know what's going on here. There are some who don't. You could see it on LinkedIn,
Yes.
as an example. Not that LinkedIn's the source for everything, but you and I met on LinkedIn, so that's
Yep.
what it's certainly a platform. But
Yeah.
yeah, there are attorneys who don't understand what the FDA does and what the laws are. So they talk about, well, you're illegal. You're not following the 361 whatever. Uh, as a clinician, I'm not bringing a product to market, so I'm not following a pathway. I'm
Yes.
working with companies, and if those companies that supply them are FDA certified, whether or not they're going through some type of you know FDA pathway, that's up to them.
Yeah. No, I completely agree. Um, another very
Mm.
common question is that I see that, does the product have any RCT trials, right? On specific stem cell products, right? So
Yeah.
like, oh, if it doesn't have any
Mm.
RCTs, I can't use it, right? So
Yeah. Let's talk about that.
yeah,
RCT stands for randomized controlled test,
trials.
or
No, trials.
randomized controlled trial. So randomized means you have half the subjects are getting a fake, what's called a placebo,
Yep.
right? So you would have to do a large group of patients and tell the patients up front, you don't know if you're getting stem cells or a placebo. No one's going to sign up for that. Most of what we do in clinical medicine is not supported by a randomized controlled trial. The surgeries we do, very few of them. A lot of the medications that are historic or have been longstanding or grandfathered in by the FDA
Hmm.
don't have RCTs. The newer drugs that are approved by the FDA for marketing claims do have RCTs because they love RCTs because it's probably one of the highest, scientific ways to study something, the highest power. But a lot of what we do is based on other types of study. And as clinicians, we start with observational study. You stumble upon something, you observe something. Maybe it was an accident, even. Oh,
Yeah.
look, I gave a patient this and I got this great outcome. Okay. Then we try to duplicate it and look at the dosing and go through things. So you don't have to have an RCT to make a good clinical judgment for a patient. This is about patient outcome, not about satisfying some panel on the FDA that's not even looking at it now anyway.
Yeah. One thing too, I was having a conversation with a scientist and we actually kind of discussed about RCT trials, and
Mm.
he said something that kind of stuck with me. So when you have these randomized controlled trial, you select a vast, a lot of patients, right? And think about them. It's a process to where you're not giving as a, okay, so you have a trial, right? And they're subjects, right? But then on the other hand, they're already coming in, um, maybe emotionally not there, like kind of skeptic, like they're being subjects. But when you look at real world evidence, right, to where if you have a patient that you're talking to and you want to use a specific, stem cell product, you're going to be talking to them. You're going to be talking to them in a way that you actually care about them. It's one-on-one. It's a very personal experience. That is very different from a randomized controlled trial. And then now think about the outcomes. That stuck with me. Does that make sense? What I said?
Yeah, I think there's a
Yeah.
subject bias, and a patient with good care tends to do better. And yeah, there might be a different bias there, right? The self fulfilling prophecy bias, or
Yeah.
or the subject bias. Yeah, all those things exist in the real world. Studies are not. I mean, look, the FDA is now reversing decisions. The FDA doesn't always make the right decision. They're
No.
they're admitting that now, right? So the FDA is not the sole determinant of medical care in the United States. It's not the sole determinant of drugs and biologics and devices, but they do regulate the claims. So we mean to be compliant
Yes.
by making sure we don't make any claims, and we make sure patients are aware that we can't make any claims.
Correct. Yeah. And then also, I know that on their guidelines that they, put out for the public, um, it says non-binding, right? This is the current thinking of the FDA, right? So a lot of people misunderstand and they think that those are written laws, right? But they're just here to enforce. If they think they have a problem, that's when they take, a company or someone to courts, and then that's when they decide.
Well, you're right. A lot of these agencies, are set up by law, by Congress, but
Hmm.
the codes aren't law. They're just codified guidelines, as you said. So
Hmm.
we mean to be compliant with those, right? Um, at least I do, and I
Yeah.
think many do. No one wants to violate that and get a
No.
warning letter, get in trouble,
No.
get that. We want to help patients at the end of the day, and sometimes helping patients trumps what um, this misinformation out there is saying.
Yeah, yeah. So on the safety side, quality control, right? What are the top five adverse events that you worry about the most, just when you're treating or you're
Uh,
helping
well,
patients?
I don't really worry about any of them with regenerative biologics if they're handled right and a vetted source. I have many fewer, if any, adverse reactions using biologics than I did with doing open surgeries, right? Which has tons of side effects and complications and risks potentials. So, I suppose with cells, there's a theoretical risk of rejection, although I've never seen it. Um, with secretome, even less so. With exosomes,
Mm,
even less so. There, I never want to cause a problem. So I
yeah,
guess if you did something in a non-sterile way, you can get an infection. But everything we do, deep injections we do at a surgery center and under surgical cleanliness,
hmm,
aseptic
yep,
conditions.
yep. Like even if
I'm
you
a
do
surgeon.
PRP, right? You're supposed to do that, right? Aseptic techniques and make sure that everything is good.
Even PRP, yeah, you should be absolutely aseptic. Any injection, you should be
Yep.
aseptic and clean and sterile. So anytime you invade the body like that, and with IVs, we're clean, but we don't need a surgery center to do an IV. We can do that, in the
Yeah,
clinic.
we'll definitely get into that. I have a specific question on
Okay.
the IVs. Those are great. So earlier, which touched up, I know at the very beginning I gave you like a kind of like an opening statement, and you're like, I want to hit each of those, right? And
Yeah,
and
yeah.
I had those questions. So for later on in the episode, right? So critics call them scam. You mentioned snake oil, right? What specific behavior in the industry earned that label? Like, why do you think it earned that label?
Oh, because there are people out there using stem cells that aren't even, physicians and other types of clinicians that are licensed to do that. Or there are these big companies that market through chiropractors. Not that chiropractors are wrong.
Huh?
Chiropractors are open-minded to treatments
They
like
are.
this. They're non-surgical. I'm all for that. But there was this whole pathway of selling stem cells through chiropractors. So watch out for these chains, these big, you know,
Yeah.
you know, things like that. I would say those are some of the things that caught my eye.
Yeah. And then another claim, another thing that I see online is that stem cells have no live cells. Okay. Does it even matter? I mean, I know, for example, like if correct me if I'm wrong, exosomes have no live cells. They're not cells, correct?
Exosomes are not cells. Uh, you know, now you're going to ask me the definition of life. What's alive and what's not, and that could be a different episode. But
I
uh,
wasn't
you know,
thinking that one, but
yeah,
okay.
cells are. First of all, regenerative biologics. Most of the work is done by what a cell makes, secreting vesicles that carry information to other cells, growth factors that carry information to other cells. This is why PRP helps, and it has very few cells, right?
Yes.
So stem cells are a delivery of these things. So you can have non-live cells in a biologic preparation and still have benefits. So, but if someone's advertising, they're giving you, 50 million live cells and you're not getting 50 million live cells, then that sounds like you're you're not getting what you bought.
Yeah.
So it's good to have an education and learn all about how biologics work, and they work by stimulating our own cells. Our own cells do the healing. The stem
Yes.
cells do not do the healing. The stem cells deliver the message of healing, the signal, back to signaling.
Yep. Yes. Yes. So one thing is that okay, what so we did touch a little bit before. So from suppliers, right? So a vendor, what do you ask from them? Obviously, there's certificate of analysis, sterility testings. What are
Yep.
other things that you know a physician should require from them, right? And then I know I kind of touched that on
Hmm.
that. And then on the cells, how will a physician know if these cells are viable or how many cells that they claim. So if someone
Hmm.
says, "Hey, mine has 50 billion cells" or whatever, right?
Right.
How can a doctor actually know if that's true, right? Because I see it a lot, right? Like they have
Yeah.
different tiers, and this one has 50 billion, 100 billion, whatever. How can
Hmm.
someone know if that's true, right?
Well, the first part of your question has to do with how do you vet a source, and that
Yes.
might partially answer the second part of your question: is how do you know you're getting what you bought?
Yeah.
So first, I choose FDA certified labs that are here in the U.S. unless we're getting something very special we can't get here, and I want labs that go through American Tissue Bank tissue donor services, so that's a regulated process
Yes.
and they're handled in a regulated process, and that they follow the regulations and they've corrected any deficiencies the FDA audit found, and that the certificate of analysis uh, has the count and it has the the protein breakdown, and it has the viral testing and the endotoxin testing and the quarantine data. We only in my practice we only use biologics that come from non-COVID vaccinated mothers because we don't want uh, the variable of the COVID spike protein, or at
Yeah.
least the RNA is related to it.
Okay.
So that doesn't mean you can't get benefit from donated products from someone with the COVID vaccine, but I just remove that variable. So that's how I vet. And I like to visit the lab and see it and talk to the scientists and see their passion for this, make sure they're doing it right. And,
Yeah.
I've had labs I won't talk to. Or we talk to them and they won't give us certain data. They're hiding
A
something,
red
right?
flag.
Red flag. So, or they have low counts. So they only sell low counts. So when we talk about exosomes, for example, we're looking in the many hundreds of billions slash trillions, and there are companies out there with here's 50 billion. Well,
Yeah.
that's not very much, you know? I mean, why are you selling 50 billion? Do you really think that's doing something?
Well,
You know?
so someone that doesn't know, right, on what is enough for a therapeutic effect, right? So how do they know what is enough?
It depends on the patient. It depends on, what issue, how bad that issue is, and then we have to, you know, find a place to start. So there's not one right answer for that, but we
Yeah.
know with stem cells, we're looking for tens of millions of stem cells, maybe up to 100 million with, um, it's different from muse cells and for other things. With stem cell derived exosome or vesicle products, we're looking for again the hundreds of billions to the trillions for the
Hmm.
type of benefits we're looking for. And then with specialty exosomes, probably less than that.
Interesting. And then one thing that I always would like that I always ask myself is when these stem cell manufacturers, when they're sending out a product, does it go by lot number, batch number? How is
Yeah.
that nuance? Because that's a little, it's a little confusing too. Like, are they supposed to send out when they like how is that the batch versus lot number?
Well, I mean, we usually get a lot number that deals with from a certain donor. So, you know, if a donor donates amniotic fluid
Mhm.
and the lab is able to concentrate, you know, 20 doses from that, then that lot will have 20 doses. And the certificate analysis matches that lot.
Okay. Okay. Interesting. So then one thing I don't think we got to it too. So how do you ensure that your cells are live, right? For those products that do
Right.
have live cells, right? How do you ensure that?
Right. You're right. We didn't get to that. Thanks.
Oh,
There
you're
are
good.
two methods. One is you've been to the lab. You've trust the COA on
Yeah.
that, and it's come to you on dry ice, and it goes in your -80, and we expect that those maintain live cells. Also, if you get a beneficial effect by using them, then you can probably assume they have live cells. The
Yeah.
other way is to buy your own, you know, cell counting device and
Do
which
that.
is a very expensive device. You take a little sample, uh, you know, when you're thawing it, and you can see the cells. That's one way to do it.
Yeah. Yeah, but it could, like what you said, it can be a lot of expensive. It can be very expensive. And then it adds another step into the process, right? So I guess it all goes back to vetting these manufacturers and making sure that, they're
Yeah.
they're doing the right thing,
Mhm.
right? Um, from all of that, what is there anything that you think is missing in today's market in regards to vetting and having good manufacturers that you see? We can, get better at this, something like that.
Well, I think we are getting better at it. So it's not just the count, right?
Okay.
You know, and the viability, but it's what we're counting. And you know, are we counting all the proper things, or is a bunch of other nonsense in there? And secondly, we're looking now at the mass spectroscopy, the protein content. You know, what growth factors are we getting? Are we getting the good healing cytokines? Are we
Mhm.
getting, you know, the right, you know, interleukins you know, anti-inflammatory growth factors, the same things you find at lower levels in PRP, but stronger levels
Yeah.
in stem cell or stem cell derived signals. So
Yeah.
we want to analyze that too. And then as we get better at it, we're looking at individual cargo of the exosomes. So what microRNAs are in there, you know, because we now have libraries of catalogs of these microRNAs and we know what they're doing, which ones are beneficial
Yeah.
for, you know, letting our own cells
Yeah.
create that anti-inflammatory optimal cell healing environment, and what's nonsense. So we're getting better at that.
Yeah, so essentially, getting deep, getting into the nuance of each specific factor component
Right.
within that product, right?
Right.
And you are absolutely right because one thing that I see, obviously, I know a lot about PRP because that's pretty much how I got into this industry. And one thing that I've seen so much is that I have doctors asking me, "Oh, is it a leukocyte rich or a leukocyte poor PRP?" And I'm like, "Well, first of all." which leukocytes are you talking about? There's five different subtypes. Okay. They each play a different role in the
Correct.
healing process. So which one are you talking about? Right? I don't know. So, I think it gets lost. And, that's why it's very important for us to define terms, clarify them so we can understand what we are talking about, right? Because even the word stem cells is thrown out and it's used broadly, right? People are saying
Yes.
exosomes are stem cells when in fact they're not, right? So it all goes back
Yeah.
to education and defining the key terms.
Agreed. I agree with you. And that's why I'm here,
Yeah.
hopefully, Oscar, to help educate just one person that if someone listens to this and tries something in the regenerative space that helps them, then we did a good job. If we dispelled some myths, we did a good job.
Yeah.
If we put the haters on their heels, we did a good job.
Yeah, and my mission. I know I asked you earlier today. I did my mission is to not spread, to share real information and have these conversations openly, right? So another question is that when you said you have your 80-degree nitrogen tank that's where you store your
Oh no, I have a -80 freezer,
minus
minus 80
80
C
freezer.
freezer, and a
Okay,
-30 C freezer. I don't have nitrogen here.
okay,
And then most of the biologics we purchase come on dry ice, and
okay.
we put them right in the freezer. And then
And you
I
put them in
only
the
pull them
freezer.
out when it's time to thaw them and use them, and we use them immediately.
Gotcha. So what's your thawing process like?
We put it in my hand and roll it around till
Yep,
till it
that's
reaches
that's
body temp.
that's what I've been told. And then like, how long does that take? Like 5 minutes or less?
If it's in the -30, straight out
Yeah.
of the -30, it takes 5 to 10 minutes, depending on the size of the vial. The bigger
Oh,
the vial, the longer it takes. The -80 takes a little bit longer.
interesting. Wow. So 20 minutes. So do you do that or you have your PA or someone else doing that?
We actually ask the patient to assist. So we'll let the
Nice.
patient be part of the process sometimes and do it, or the nurse will do it. If
Nice. You're involving them in it.
Oh yeah, if it's for them, and if we're doing an injection under sedation, then we'll do it for them because they're
Yeah,
they're
of course.
snoring. Yeah.
Interesting. They're loving it. What do they tell you when they're thawing it? Wow, they're probably amazed, right?
Well, we show them the certificate of analysis. We
Yeah.
keep a copy in their file. We want them to see and understand and be part of it. We don't have anything to hide.
Yeah.
It's not. It's the magic is in knowing about it and seeing the logic. You know, the word biologic has logic right in there. We should be using these biologics. They are the most logical approach. They're way better than me inserting titanium screws and rods into your spine. Don't get me wrong, there's still a role for that, but we
Yep.
need to reduce that role. It should be a downstream for people that absolutely have to have it. It's way overused. And because of it, spine surgery, for example, has a bad reputation because it's been overused, or doctors don't take the time to figure out the source of pain well sometimes.
Yeah.
And then you get these bad outcomes. Well,
Yeah.
we want good outcomes with the least invasion. So
Yeah.
I feel that that's the most Hippocratic thing we can do.
I agree. And even as a patient, right? I don't want to implant in my body. I want to see what else is out there, right? As a patient, I would love my physician to have the knowledge to tell me and say, okay, Oscar, based on X, you can have autologous PRP, which is good. You have then you have perinatal stem cells, exosomes, secretomes, whatever. And then based on this, and then allow me as the physician to do my research. I'm sure everyone goes back and does their research, right? They listen to the doctor, get some, maybe second opinion, and then go read and see what the best decision is. I feel like a lot of physicians also are just kind of offer this product and that's it. And they're not open.
Yep.
I would love my doctor to
Yep.
show me, hey, this is my
Yep.
toolbox. What do you need?
Yep. Doctors, put the Kool-Aid down. There's a lot's happened since you went to med school, trained by people in your residency who trained 30 to 50 years earlier. A lot's happened. Go look for it. You have to go seek it. You're not going to find it unless you seek it. And it's almost unethical not to update yourself and,
Yeah.
and take
Yeah.
off the blinders and look around. It's here to stay.
I agree. And it's not holding back. Um, we mentioned outcomes and how are you tracking outcomes, right? And
Well,
how are you tracking
one at
outcomes?
a time, n equals one, n equals one, right? So we really go through a battery of symptoms before we do something. and then we go back over that battery. When I do the joint work, we talk to people at 1 week, 1 month, 2 months, 4 months, 6 months, 8 months, 10 months, 12 months, and beyond if they need. But most people with the joint approaches are better by the 6 month to 12 month range. We document.
Yeah.
Some people, if they're open to it, to do an MRI, because we target off of MRIs ahead of time. So we'll do an MRI after, only if they want, because if they're feeling great, there's no reason to do an MRI.
Yeah.
But we have some before and after MRIs where we've shown that cartilage to improve. So
Wow.
that's well, we will do it if they want. It's an
Yeah.
expense, but we'll do it.
Yeah. One thing that I learned in my journey in learning regenerative medicine, the use and regulatory and all that stuff is that have you heard of the expanded access program and then also the right to try? Do you think that that applies, that doctors can use that in this, when they're using stem cells, or it's not
Well,
necessary?
I think we are using right
Yeah.
to try.
Okay.
I mean, with everything, even though I was using right to try before there was a statute for it. So, I
Yeah.
mean, doctors do many things that's not approved by the FDA.
Yeah.
Some things have grandfathered in, some things are just approved for one thing. We use them over here off label.
It's off label.
Some things have no label. We've been using them anyway in treating brain injury and things. We do all kinds of off off use, propofol for brain injury, things like that. So
Um,
um, that applies, in surgical realm. The FDA does not regulate surgeries; they regulate the implants.
yeah.
And the implants are now, not now. They've often been used for things they weren't approved for. So that's common.
Yeah.
So there's always been, I guess, right to try, sort of parenthetically as part of that,
Yeah.
and expanded use. I mean, the Hippocratic Oath calls for us to try if the patient wishes through the informed consent doctrine.
Interesting. Okay. Um, so, in your opinion, how many stem cell outcomes are placebo and why? Why do you feel this way?
I don't know that we have regenerative biologics that have had placebo based.
Yeah. But yeah, because
Uh,
you've seen the MRI, you've seen them get
I'm,
better.
I'm
You've,
not using placebos,
yeah.
so
Okay.
I mean, I don't know. But if I give someone a regenerative approach and they improve, whether it's in their head or in their body,
Yeah.
we get the same result, I think. So if they're
Interesting.
happy, that's all I want, is happy, better patients,
Of course.
healthy, happy, better, so they don't need me or anyone else.
Yeah. And then they'll refer to their family and you feel better just helping patients.
Oh, for sure.
Yeah. So I have three questions to close off the podcast. Okay. What is your prediction? Will regenerative medicine become mainstream evidence in the next 5 to 10 years?
Oh, I think it is mainstream evidence. It's just not mainstream adopted because of the sick care system and the undue influences from non-educational parties.
Yeah, I agree with that. I mean, that's what patients are
Yeah.
stem cells here, stem cells that, they're flying outside of the country to get these therapies.
And you don't
Um,
need to.
yeah. So another question, what should the average, so let's say, an average clinicians that wants to do using stem cells, right? What should they do today?
They should educate themselves, go to some conferences, read some textbooks, watch some videos, shadow some doctors who are doing it, and getting good results. Learn how to vet a lab and a source, and then there should be nothing holding you back. Make sure you learn how to do a good informed consent. Maybe,
Yes.
maybe like you said, Oscar, have the right attorney bless that process, and and then go help people.
Yeah. Yeah. That's what doctors are for, right? To help people, to help them. Uh, I agree. So
Despite what you see on LinkedIn with some of these haters and what they're saying. So
yeah,
you're cutting into their business.
I agree with that 100%. I always like to say, follow the money, right? Follow the
Follow
money.
the money.
Yeah. That's with everything, right? Not
Yeah.
just there.
Yeah.
Last question. So, I've been getting some messages from, medical students and some even, researchers that are in school right now. And they want to get into stem cells, right? Or regenerative medicine, right?
Yeah.
And what should be the first step that they take into, they're already in school and they hear stem cells. What do you recommend for them?
That's a great question, and I would love for medical schools to add a curriculum on stem cells. I'd be all the medical schools listening. I'd be happy to help you with that. Teach some courses, some lectures. We could make an online available to all of you. We would love that. But they should read on it. They should try to find a rotation in it.
Mm,
In med school, you do rotation. So find a rotation somewhere, and look for a residency program that involves it. So it might be sports medicine that has some regenerative approaches, or they have a faculty member that does that, and you can tap into that faculty. So it's out there. You gotta seek it.
okay. Awesome. Well, any final words, any last words for you?
Yeah. Don't believe everything you read on LinkedIn, and ask yourself, why are people saying what they're saying? Do your homework. Don't give up. Look for all options, and make sure that you understand the myths and get educated, because there are things we can do for people in the regenerative space to help delay or avoid surgeries, to help them be healthier and help their body live longer and healthier, to improve their health span. So seek it. It's there. You don't have to leave the country. It's not cost prohibitive anymore. It's doable.
Amen. Well, thank you very much, Dr. Gross. It was a pleasure having you. Thank you for answering, many questions that I've seen online, and I've just been gathering as I've been, vocal, debating other doctors, and just kind of, getting into the nuance and all these questions because these are the most very common questions, and I hate to see going back, and I'll end with this that many patients are looking for hope, looking for answers. And I feel like, all the misinformation and the fear mongering is not helping patients. And even doctors, it's discouraging them the use and innovation and actually helping patients, which that to me does not sit right, you know?
I could not agree with you more. Thank you for having me and giving me the opportunity to help spread the real transparent truth on this stuff and what's out there.
Awesome. Well, you guys have a beautiful day. I'll talk to you later.
Too.
Adios.
Bye.